Hello, my name is Dr. Tom Lavin. Thank you for coming to our website. I would like to introduce you to our educational material and seminar. This is the first step in helping you gain a further understanding of really what we have to offer you and how we can help you. We have created one of the most experienced and comprehensive weight loss programs in the United States. We're a big family. We've been together for 16 years. Almost all of our employees have been there most of that time. We have probably performed now between 12 and 14,000 laparoscopic bariatric surgeries. We are one of the busiest practices, if not the busiest in the United States. We have worked it where it's all about the patient. We have dietitians, people that specialize in exercise, nutrition, bariatric nurses, financial and insurance specialists to help you get approved or help you get financing. So we have the whole practice that is there for the bariatric patient. And I tell people also it's lifelong care. I mean, we want you to lose your weight in a healthy manner and keep it off lifelong, and we're here for you, cheering you on. And we've seen so many people that have been out there fighting the weight and medical problems, and suddenly they come in, and in one hour procedure, their life has changed, and they become part of our family. And so that, we've seen it so many times. We know the impact we can have on people. We are a New Orleans-based practice, but we have locations in Metairie, Covington, Slidell, and Lafayette. We have patients come from all over the country and all over the world, Europe, South America, Middle East. So we have people come from all over, but we're here to take care of you. We have advocates that will take the call. We do phone consults for our distance patients so we can make it smooth and easy, and you can have an experience that'll be life-changing for you. So when I tell people about bariatric surgery, I tell them it's a 45-minute to 1 hour procedure done laparoscopically. It will transform your life in not only quality of life, but health also. We see diabetes resolved, hypertension go away, sleep apnea go away, and the little things that people don't even realize. I tell them your joints will quit hurting or improve tremendously. Shortness of breath will improve. You will sleep better at night. You'll wake up like you're really rested with energy for the day. So it's those little things that you forget about. Even people that have chronic sinus problems, that gets better because your sinuses are doing better. So across the board, from a health standpoint, getting off medicines, feeling better about life, it is a transformational health experience. The laparoscopic sleeve gastrectomy, otherwise called sleeve, it does not alter the GI tract other than shrinking the stomach. It doesn't have any impact on absorption, which is safe, and we like that about it. It is purely a capacity and metabolic, meaning hormonal changing procedure. The way we do it, we have 3 little incisions, with you fast asleep. I'll go in and take a football-sized stomach and make it a long banana-sized stomach. So obviously you have decreased capacity, but you also have decreased hunger and cravings because all of your hormones that drive hunger and cravings are changed when we do that procedure. That is what I do the most of because, like I've said, it's a safe, effective procedure in my hands, and we take care of people that want to lose 40, 50 pounds up to 300, 400 pounds with that procedure, teenagers up to people 80 years old. So it is very effective. Patients get back to normal activities in 4 to 10 days, so you're back pretty quickly. Like I've often said, this is not a surgery where you just get your procedure and you're done. We have lifelong support as far as nutritionally and recommending exercise and making sure you lose your weight and keep it off long term. So we have a big team that helps with that, and patients, we tell patients, we're your go-to doctors forever. Granted, we might see someone once a year over time, but just to make sure you stay healthy, keep your weight off long term. The other procedures that we do are laparoscopic gastric bypass, We do much less bypasses today because the sleeve is pretty equally effective without some of the complications. Bands we do not do. I don't do bands anymore. There are some doctors that still do them, but that has a very limited role. For patients that need to lose 300, 400, 500 pounds, the duodenal switch is a better procedure. It has the upside of more weight loss, but the downside of it does affect absorption. So you have a higher risk of vitamin and protein malnutrition with that procedure. So we do that much less often. One of the things that I like people to understand is, why does bariatric surgery work? And there's complete confusion out there, not amongst only lay people, but physicians in general don't understand. So what happens when we do bariatric surgery, and I'll speak specifically of the sleeve gastrectomy, or otherwise known as the sleeve, that has a tremendous impact on gut hormones. Those are hormones produced in the GI tract that are totally changed after a sleeve, and they alter a patient's hunger and cravings. Most patients have no hunger, and all of their cravings that kept them from losing weight in the past are shut down. So patients no longer have that cravings for chocolate, for candy, for salty, for bread, carb cravings. So those things go away. In addition to, of course, with the sleeve, you take a football-sized stomach and make it more banana-sized. So by getting rid of cravings, hunger, and shrinking capacity, patients are set up to win and lose weight. Compare that to a diet. Everyone comes in and they think, I've failed so many diets, maybe this is one more thing I'm going to fail. I say no, because diets don't do the things that bariatric surgery does. Diets have no impact on hunger, no impact on cravings, no impact on capacity. So it's just suck it up and do your best. And hunger and cravings are two of the most powerful forces in the universe, and long term, they win. I mean, I don't know anyone who's lost 100 pounds on a diet and kept it off. The theory today on why bariatrics works and other things don't work is something called the set point theory. As we gain weight, our brain has this set point that's constantly growing as patients gain weight, or as people gain weight in their lives. And so your body comes to accept your present state as something that is normal and should be defended. Meaning, if you gain weight and go up to 250 pounds, it's like a one-way street. There's no way back, because your brain shifts the set point up to 250 pounds. So when you say, okay, that's it, I'm gonna lose weight. So you go on a diet. What happens? You drop your calories and your hunger and craving hormones skyrocket. So suddenly all you can think about is food every second. Not only that, you may lose 10, 12 pounds and then you hit a brick wall. That's because metabolism then drops down, says that's it. It is defending that set point that they think, your brain thinks is normal. It's not normal at all, but because of today's modern society with limited activities and all the engineered food we have in front of us and easy access, that's what happens. So as people gain weight, like I said, it's a one-way street. You're not going back, not easily anyway. And so you may have small gains, but because of that set point and your body vigorously defending that weight and it wanting to be there, it is a very difficult battle for patients. So everybody comes in and tells me the yo-yo story. I lost a little weight, I lost 10 pounds, I don't need anything, but I can't lose any more weight. And that's because that body is trying to defend that weight. What bariatric surgery does is lowers your set point. It does that by totally altering those hunger and craving hormones and altering capacity. So once again, diets don't alter set points because they don't affect the hunger and craving hormones, and they don't affect capacity. So they're short-term solutions to a lifelong problem. That's not to say that someone that's 10, 15, 20 pounds overweight, you should be able to lose that and maintain it. But once people get 75, 100 pounds overweight, it is virtually unheard of. I mean, I will challenge anyone, find me the person that lost the weight and kept it off long term. The pediatric obesity problem is really significant today, and you see children that are 10, 11, 12 years old with adult diabetes, sleep apnea on CPAP machines, cholesterol problems. I mean, diseases we used to see in 40-year-olds, we're seeing in 10-year-olds. So the problem over 30 years in this country has become very significant, and so our whole push now, our passion is to help this population too. So we brought on a board-certified pediatric obesity specialist last year, Sophie Lancers, and we're just developing the program right now where patients can come in and get all of their care to get in a full comprehensive program that involves their family to help them get a chance at getting that weight off and keeping it off. One of the things that we are very hopeful for is the set point theory, like I talked about. This set point over time becomes more ingrained. So we're hoping that in the pediatric population, it seems to be easier to turn around this patient group and get them to lose weight and keep it off. Pediatric obesity is, a big problem in our society, but it's a big problem in families too, because the children are set up genetically in this environment, so it is a battle they have, and so it turns into a very emotional, very tough, tear-filled battle with the parents. We see it when they come into our practice. Parents, when you feel your child has a weight problem and they're not gaining on it over time, or it's getting worse, Dr. Lancers is here to help out and intervene. That's what she's dedicated her life to. It's had a lot of success helping patients turn that around at a really young age. That's not to say that some patients will need surgery, but the majority of the pediatric patients should not. When it comes to obesity, it's basically a chronic disease, and it's multifactorial. I mean, it's part genetic, part environmental, part behavioral, part psychological, a lot of factors. But the big thing is genetics combined with our whole engineered easy access to food with low activity in our society. We're a setup right now for weight gain, and we see it. So revisional bariatric surgery, it means you had bariatric surgery one time, you may have lost weight, probably did, but you start gaining it back. And so we see that with any bariatric surgery. Most patients never need revisions. Sometimes people think, oh, everyone needs revisions. Most people that get bariatric surgery will never have a revision, but some people do, and maybe a third over time. And those revisions, in a bypass, you're basically shrinking the pouch and you're tightening it up so they can get back to close to their original decreased hunger, decreased cravings, decreased capacity. We do all the revisions laparoscopically. The other procedure that can need to be redone is the sleeve. And the sleeve is done a lot of ways. When you say you had a sleeve or you say you had a bypass, it depends who did it, how they did it, how they constructed it. So that has a big impact on both early weight loss as well as long-term weight loss. We are so experienced in revisional bariatric surgery. We have patients come from all over the United States for us to take care of them right here because we do it all the time. And revisions are different than primary surgeries in that you need to go to someone who is very, very experienced because they're more difficult and riskier in the wrong hands. So that is one of the procedures that your patients will come from all over because we do that all the time. As I said, we have a lot of patients who will fly in from all over the country for both primary and revisional bariatric surgery. On our website, we have everything set up. We have concierge advocates in our practice that do nothing but guide people through the entire experience. Our hospital and office are all within 10 minutes of the airport, so it's very convenient. Most people will fly in either Sunday night or Monday morning, and on Monday they'll have their consultation with me, have the procedure done Tuesday, go to the hotel for Wednesday night, and Thursday we see the patient in the office. In the morning they fly home. So that's the normal routine for our out-of-town patients. So you'll be guided through the whole process. Our bariatric practice is set up to help people locally, long distance, and we take care of everything. So it takes just one call or one trip to our email or our website, one trip to our website, and then we can pick it up and help you through the process and make sure that if you need a cardiac clearance, we can help you get it. If you need help financing, we'll make recommendations. We have patient advocates that have been with us 16 years that are experts in getting insurance approval if you have bariatric coverage, of course. And so they will pick you up and go over all of your options and start the process. And so there's no need to go to any other doctors. You can come directly to us. My whole philosophy on health is you should be thin, not smoke, eat better and avoid processed foods, and try to get off as many medicines as you can. So I'm more of a naturalist doctor in that I really think that people we're creating a lot of our own problems with too many medicines, too much polypharmacy, and not enough attention to the basic wellness factors of living thin and not smoking, and trying to avoid the pharmaceuticals. I have patients come in on 20, 30 meds from 12 specialists, 15 specialists. How do you even know what all those drugs do in you? It's frightening. So my goal is to help them lose their weight, get healthy, get off their meds, get active in life again. And the other thing that we feel is very significant is making sure patients are seeing someone that can follow their hormones and make sure that they're maximized at whatever age you are in your life, so you can be the healthiest and highest functioning person no matter how old you are. The whole field of bariatric surgery has evolved over time, once again from an open era to a laparoscopic era around the late 90s. And then over the past probably 6-7 years, we now do endoscopic or endoluminal or incisionless procedures. Let me explain exactly what that means. It means patients are sedated. You don't need to go completely asleep. And we go down through the mouth, just like a normal endoscopy. And today, the FDA-approved procedures are all balloons. There are 3 approved balloons on the market. They basically take 10 minutes. We sedate patients with propofol, and we go down with the scope, blow the balloon up under direct vision, pull the scope out, patients wake up and go home 45 minutes later. That's not the end. That is when the work begins with the balloon, because a balloon is it's very important with the balloon to follow up with your dietitian and work with our practice through the 6 or 8 months that you have the balloon, because that's when you can lose your 20, 30, 50, 60 pounds over that period of time with dietary counseling and with the balloon in place. It's kind of easy to visualize what a balloon would do in your stomach. It takes up space. So now you only have 20 or 30% of your space to eat with, so you fill up on smaller amounts. And most patients say they have much less hunger too. Over the 6 or 8 months, that drops off. So when you're in your 5th or 6th month, you're not feeling that feeling you felt the first 2 months when you couldn't eat much at all and you really had no hunger. But the balloons have been very effective, and they're very safe and straightforward, and gives patients a period of time where they can lose their weight and get ready for a long-term commitment to maintaining that weight. So at the end of the 6 months, we'll go down and pull the fluid out of the balloon and take it out, and then patients go home about 45 minutes later again. They continue the dietary counseling with our dietitians over the next 6 months to work on maintenance or any further weight loss. And like everything, it takes work, but this gives you a significant advantage over straightforward diet and exercise where you have no capacity limitations. The balloon is a very safe, straightforward outpatient procedure done under propofol. You don't even need to go to sleep. It takes about 10 minutes, and once we place the balloon, the work begins for patients, meaning we have a whole program with our dietitian that will work with you through your whole 6 months to make sure you have weight loss and the counseling and support you need to get that weight loss. In the bariatric field, there are always advances. I mean, from the first advance, which was just going from the open surgery to laparoscopic, where we were doing these procedures either outpatient or one-night stay, and people are back to work at 4 to 7 days. I mean, that was a huge advance. So the whole laparoscopic, minimally invasive technique has changed these procedures, made them very safe, very limited downturn. So we've always been on the forefront of that. And like I said, from my first patient I took care of and watching the transformation in his health, this has become a passion for me like it is all my partners. So we take care of a lot of people. We do a lot of clinical research on new techniques, where we have a balloon research trial going on right now. We've had research trials going on with other endoscopic, which means incisionless procedures for weight loss. And so we've really led the field in a lot of those areas, because we're always looking for what's the safest, what's the most effective way to help the most people. I've gone around the world and talked to people around Europe and Scandinavia and all over the United States with the International Federation of Surgical Obesity and our ASMBS, our American Society, and we've done live telesurgeries for the American College of Surgeons. So we're always involved in educating and teaching everyone internationally. So starting with my initial laparoscopic gastric bypass back in 2000, 2001, the practice has just expanded, and we started doing lap bands after that. We had a run of a period of time before the sleeve started becoming a very popular procedure. So for about 9 years we've been doing the sleeve, and the sleeve gastrectomy has really displaced most of the other primary surgeries, because in our hands it's such a safe, effective procedure that really, really helps patients. So that has really become the mainstay in the United States of what is the best procedure, I feel, for most people. We have a large research arm of our practice where we're always looking at new things that will help patients out. One of the big areas, we work with a lot of industry, and we have FDA trials going on frequently in our practice, so you can check our website to see what open trials are ongoing. One of the things coming up in the next probably 6 to 12 months is we'll be looking at the pediatric population as far as balloons in the pediatric population, as well as a research protocol for sleeves in the pediatric population. So those are two areas that obviously pediatrics is a big area for us in 2017. So those are two upcoming trials that really could have big benefit for the population.